For this Pearlcast, I would like to talk to you about the diagnosis of overactive bladder. And I'm going to base this talk on the American Urological Association and SUFU guideline for the diagnosis and treatment of overactive bladder, which is non-neurogenic in adults. This guideline was put out in May of 2012. So overactive bladder is commonly referred to as OAB, and by definition, an OAB syndrome is urinary urgency, usually accompanied by frequency and nocturia, with or without urinary incontinence, and the absence of urinary tract or other obvious pathology. So it's important to point out that this is a clinical diagnosis characterized by the presence of bothersome symptoms. So, what are these other words? We have urgency, we have urge urinary incontinence, frequency, and nocturia. So to define these, urgency is the complaint of a sudden compelling desire to pass urine which is difficult to defer. This is different than just the normal urge to void. Urge urinary incontinence is the complaint of involuntary loss of urine associated with urgency. Frequency is really just the number of voids either during the day or night, and usually people have approximately 7 to 8 normal daytime voids. However, the complaint of increased urinary frequency is just that, a complaint that micturition occurs more frequently during waking hours than previously deemed normal by the woman. It's really just a relative perception of what their normal is. Nocturia is the complaint of interruption of sleep one or more times because of the need to micturate. Each void is preceded and followed by sleep. Now, it's important to know that nocturia in and of itself isn't necessarily from a bladder issue. There are other reasons, classically things like heart failure, sleep apnea, or problems with sleep cycles could also cause isolated nocturia. So let's discuss a little bit about the epidemiology of overactive bladder. The Agency for Healthcare Research and Quality, also known as the AHRQ, would say that maybe 5 to 10% of women will experience overactive bladder. But there are other reports that would say that it is as high as maybe 40% over a woman's lifetime. But maybe what's probably most important to note when people do these population-based studies is that the occurrence and the severity of overactive bladder generally increases as a woman's age goes up. So what's the social impact of this? Well, overactive bladder is associated with a decrease in quality of life, sexual function, marital satisfaction, and has an association with increased depression. So overall, it is a very bothersome and costly syndrome to have.